Let's continue the discussion now with Sasekani Manzini, the MEC for Health in Mpumalanga. Very good evening to you. Thank you so much for speaking to us. When we talk about alarming, where do we put the figures specifically for Mpumalanga?
Good evening to you, Tsepiso, and to the viewers at home. Indeed, it's a serious concern for us as a province. We can say that last year alone, we had 12,319 deliveries in the province. And as correctly said, we are number 4 with 16.2% after KwaZulu-Natal, Eastern Cape, and Northern Cape. And this, we are finding it very concerning because it's in your rural communities. Yonkomazi, your Bushbuck Creek, Mkondo, where most of our people are in rural areas. And that you will understand that in terms of being rural in their nature, sometimes that information and the manner in which we were raised, I'm also from Bushbuck Creek, I know that it's difficult to talk about things like sex, and even the community themselves, they don't talk to their kids because it's a piece of how you relate to your children now. It should be different from how we were raised by our own parents. But you find that even same young people of our same age, they don't talk to their kids. They wait for their kids to get information from their friends, being influenced. Like you have heard, one of the people that was interviewed, that is peer pressure. You only told about sex by your friends and you want to experience because your own parents at home. Hence we are saying everything must also start at home, from the community level. Your churches, your traditional leaders, the people that are around us as leaders in the communities. We should start talking about this thing. And of serious concern also, Tsepiso, is that 10 to 14 years, how do you then justify that the 10 to 14 years got pregnant because
and you see, this is where I was coming.
To have sex. So
this is where I wanted to take the
yes.
conversation, because as you say, that part of the problem is the inability or unwillingness of parents, despite the shortened generational gap, to talk about sex. But 10 to 14-year-olds, we cannot be saying that a large number of the teenage pregnancies that we're seeing are as a result of sexual intercourse or interaction with their peers. The issue of abuse, it seems that we don't find it easy to talk about in our communities, whether it's by family members or community members. Talk to me about those figures. Are we having real conversations about the burden of those incidents, what they share, and the high number of teenage pregnancies that we're seeing?
Yes, that is a discussion that looking at the numbers is of serious concern. And hence, we have launched a program as a Department of Health where we are together with our traditional leaders. We go to their offices, we provide services there with believe that as we are there, we'll be able to interact with the community and talk about this kind of things. And also, they agree with us to say, how do you then say a 10 or 14-year-old just got pregnant because of peer pressure? So this is where the issue of criminal law must come in terms of sexual offense, because it is clear that even those people that impregnate these children, they should not be older than 2 years. If maybe we are talking about whether, because there's that is saying that maybe they are trying to experiment the things that they are seeing on TV. But it goes back because the rural nature of the high number of pregnancies and the children in that area, it tells you that in the main is something that we need to talk about as parents, so that they can allow us to be able with SAPS, so that when we get such cases in our hospital, there should be some way of reporting those cases so that it is dealt with at a level where these people must be further investigation, so that we can be able, even those people who are impregnating these young girls should know that if you are sleeping with a child and the child become pregnant, then you'll have to answer in terms of what happened and be able to, even the families themselves, so that they can't continue to hide because they know it is not possible that
So-
you'll have a child
so MEC
being pregnant and you believe that is just teenage pregnancy.
Let me jump in and say this. Your views on the importance of using the correct language. Statutory rape is a thing for a reason. So when people say there's this phenomena of blessers and people are looking at their Instagram or social media idols and therefore they're sleeping with all. Why are we not having honest conversations about the pandemic level of statutory rape? Because they say in rural areas there's this continuing practice of child marriages. An adult male in their 30s,
Yes.
40s or 50s cannot be having sex with a 10-year-old.
Yes, and the issue of Instagram in those areas like Bonkomazi and Bushbuckridge, you find those kids that they don't have anything. It's not like they are trying to sponsor some lifestyle, because it's not something that is you can have pressure towards having those things. So it tells you that there's more to it than just to say these kids, they want to sleep with old people. So that's what I always emphasize in terms of even telling parents. I like that because some parents now, when you talk to them, they realize that there's something wrong that they're doing. And they are willing to say, no, thank you very much. We can see that we need to do something. So it's just that sometimes you can't be everywhere. Hence, we are saying we need key stakeholders in terms of talking about this. Hence, we're happy that young people on their own, they were able to organize young people. And these were teenagers from school because they were in their school uniform to say, come, Department of Health, we organize different speakers to talk about this teenage pregnancy so that all of us, it becomes a societal matter, so that it becomes a discussion that all of us, when we see a child being pregnant, you should know that if there's nothing that is done, you should take the step.
So this interventions that you're taking, and I laud them, especially around family planning facilities. Some of these young children, and I've been part of these programs where they complain about the abuse that they receive from nurses, whatever. We understand that even young teenage mothers face obstetric violence. What are you doing about that? That these young children are not further abused when they give birth or in the hospitals?
Correct. Hence, as a department, we can say that out of 292 clinics, 212 clinics have what we call use zones, where our clinics are user-friendly. We are able to provide, we've got dedicated nurses that understand that they are dealing specifically with teenagers. And over and above that, when they come in their school uniform, they don't have to queue with all these older people asking them whether they are sick or what they are doing. So we are making it easy for these teenagers to be able to go and access information, because that is very important also, because in terms of those youth zone, we even categorize them according to their age, 10 to 14, 15 to 18, and 20 to 24 years, so that with the same age group, they can discuss issues that concern them, they can get the necessary support that they did than going to a clinic. You're correct. Some nurses, they want to be parents when they're supposed to be providing services to these young people. And also in terms of, we know that young people are using social media and they're using their phone. There's this digital health information that is there. You can Google, which is called Be Wise, where you can, with your at your finger tips, you could be able to get young people and then be able to interact with and get the information that you want.
Thank you so much for your time, MEC. Wish we could talk more. Sasekani Manzini, Health MEC of Mpumalanga, talking about the rising levels of teenage pregnancy in the province and, of course, nationally as well.